There are two things in the Care Act that I would like to highlight. The first is the general duty in the legislation to promote individual well-being. And this is a really vital statement of intent in the Act itself. We see at the Stroke Association over 70,000 stroke survivors and carers a year. And through our services, we're already trying to promote individual well-being. But I think such a statement really upfront in the legislation is really helpful, and we've certainly welcomed that. The second thing is a problem that we've become aware of over the past couple of years around carers assessments. And the problem was that carers have told us that they were not being offered a carers assessment without the local authority first wanting to know how much money they had in the bank. Now, this is a major problem because for carers, often what they need is access to free information and advice and information that doesn't necessarily cost money. So if a local authority is first looking to assess how much money a person has got before offering them a carers assessment, people can be missing out on access to peer support or befriending or free information or other information that could really help delay or prevent somebody's needs becoming much more acute further down the line. I said there were two areas, but actually there's a third that I'd like to highlight as well, and the third is around advocacy. And the Act is really clear that people should have a right to advocacy if they're not able to actually communicate or express their own wishes and preferences clearly. Now, stroke is one of those things that can actually affect people emotionally, it can affect people physically. Often there is a condition called aphasia that also accompanies stroke, which is an inability to communicate, often to speak, but also to understand or to comprehend sort of complex messages. And so this right to request an advocate is something that we think is going to be really helpful in ensuring that the 100,000 people who survive stroke each year in the UK are able to fully express what it is that they want and need in order to live a dignified and independent life. And that's why we're encouraging people to use the Care Act, both stroke survivors and carers, as a way of actually achieving that dignity, a way of achieving that independence, and actually a way of people being able to negotiate with their local authorities in a way that perhaps before was really difficult because there was so much contradictory and conflicting advice, guidance, legislation, case law, all conflicting with one another. Now, with a single unified statute, we are really encouraging people to use this as a way of enabling and empowering themselves and those around them to live and make their best possible recovery after stroke.